women, there's a reason why doctors recommend cesarean section. In some instances, we found out that some women found it so difficult to accept this, even when they see that they are at risk or even the baby is at risk. There's need for enlightenment so that you will know that for a doctor to have requested for a CS, be it an emergency CS or be it elective CS, then there's a reason for it. First, we like to define what is a cesarean section. So we call it generally CS. It's cutting through the pelvic region of a woman, that's a pregnant woman, so that the doctor will be able to bring out the baby from her uterus. Uterus generally is well known as womb. Gynecologists cut through the wall of the pelvic region, to deliver a baby from a pregnant woman through a surgical operation. Then we want to find out what are the causes of this cesarean section. Number one is prolonged labor. When a woman has been in labor for long and she's just in labor, she has moved from the first stage to the second, she's in the third stage, and still she's just finding it difficult, to bring out the baby, then there's need for an emergency CS, because you don't want to risk the life of the baby, neither do you want to risk the life of the mother. So there's need for an emergency CS. Multiple pregnancies or multiple gestation is where you have a woman carrying twins, triplets or quadruplets, as the case may be. The babies are many in the womb. I don't want a situation whereby you're saying, oh, if we had known, if we have, you just want to play safe. So a doctor can recommend a cesarean section. So cephalopelvic disproportion is whereby the head of the baby or the body, even the baby also, is larger than the birth canal. So in as much as the vagina can, stretch, expand, and accommodate the size of the baby, sometimes some babies are big, and then to prevent stories, the doctor already examined, even sometimes based on pelvic scan, that okay, this baby cannot pass through this pelvic canal. So you will want to play safe and then recommend CS. In as much as the baby cannot pass through, then why wasting time? It's but the major thing is baby being alive and the mother doing well too. So sometimes it could be as a result of non-gynecoid pelvic, whereby pelvis is not structured in a way that it can allow a baby to pass through. And also, there could be placenta previa. Placenta previa, whereby the placenta is not lying where it's supposed to lie. So sometimes the placenta is lying close to the cervix, or it has even blocked the cervix, and which is the pathway through which the baby will pass through. So in this case, placenta is already blocking the path. Where will the baby pass through? Obviously, you know that CS is advised in as much as you want the baby to come out. Because if you're trying to force the baby to pass through, is it that the baby wants to pass through the placenta? And if the placenta did not even block the cervix completely, is beside, baby trying to pass through could cause bleeding, and you don't want bleeding. The woman already had CS. You want to play safe. Sometimes a woman can have CS and then wants to deliver again and deliver normally. It's okay. It's fine. If that is how it's common, we want to play safe as much as we can to avoid stories that touch. Fetal distress. Sometimes the woman has been in labor, has been, struggling to bring out the baby, and then push, could not push. As the woman is trying to push, also the baby is trying to come out. And in as much as the baby is trying to come out, but there are some obstructions, the baby can go into fetal distress. And once there's fetal distress, you don't want a situation whereby the woman has carried pregnancy for 9 months, and then at the end of the day, the baby is born and nothing. Once there's already fetal distress, baby is already in distress, immediately is an emergency CS. So you don't even need to be saying, oh, why are they recommending CS? Why? Once they've explained to you that this is the reason, then just accept, go ahead and sign. Umbilical cord prolapse. We all know the umbilical cord. Sometimes the cord comes out. It comes out before the baby. And once it comes out before the baby, that is an indication for CS. It can hinder the blood supply, the blood supply to the baby. And so in as much as the cord has already descended and the baby is still in the uterus, you don't want a situation whereby the blood supply is disrupted. So that is an emergency CS to avoid issues.